Good afternoon. We are about to start our physical assessment video. The patient will be Lauren Saliga. The nurse, Trina Jones. And I, Michael Dapp, will be doing the narration. The first thing a nurse wants to do in her introduction is knock, introduce oneself, check patient armband, verify name and date of birth, and explain what she is about to do.
I'm going to be doing your assessment today. Can you tell me your name and date of birth?
Lauren Saliga, 1289.
Okay. I'm going to be doing an assessment. If you feel uncomfortable at any point with me touching you, just let me know.
Okay.
It's supposed to be a safe touch. And are you allergic to latex?
No.
Okay.
At this point, she wants to give the patient and her some privacy by either closing the door or a curtain, and look at the ergonomics to raise the bed and head of bed so it's easier on the nurse. She wants to wash hands and put on gloves if desired at this time. Once the bed is in position, she would like to do the vital signs, checking the blood pressure, respiratory rate, temperature, oxygen saturation, and of course, ask if the patient is having any pain.
Ms. Saliga, are you in any pain at all right now?
No.
Okay. And I would take my vital signs and document them in the computer.
Moving on to the neurological aspect, she would ask questions like, where are you? The day or the date, President of the United States, and a memory question.
Ms. Saliga, can you tell me where you're at right now?
Oh, yes, I'm in the hospital.
Okay. Do you know why you're here?
Just haven't been feeling very good lately.
Okay. And do you know what today's date is?
Today is the second?
Yeah.
Third?
And the day is?
Thursday.
Okay. And do you know what you had for breakfast?
I had Chick-fil-A.
Okay. Thank you.
All right, now we will move on to the cranial nerve assessment. Cranial nerve number 1 is olfactory. That's the sense of smell, able to detect various odors in each individual nostril. You would have the patient smell non-irritating substances, for example, coffee.
Sit her up. Ms. Saliga, I'm going to ask you to close your eyes and cover one nostril. And can you smell this?
Yes.
Can you tell me what it smelled like?
Minty.
Okay. Can you cover the other nostril? And smell? Can you tell me what it smelled like?
Minty.
Thank you.
Cranial nerve number 2 is optic. It's the sense of vision, clear vision near and far. You may use the Snelling chart or a clock on the wall, or for near, you'd like to read a book or a menu.
Ms. Saliga, can you tell me what that sign says over there?
It says clinical reasoning.
Okay. Thank you. And can you read what this label says?
Breath.
Okay.
Number 3 is oculomotor. She would at this time do the PERLA, which is pupil, size, shape, equality, reactivity to light, and accommodation, using a pen light.
And I would turn off the light at this time. Right now we don't have that ability, but I would turn off the light and ask Ms. Saliga to focus on the wall. Good. And I would also ask her to look at the top of my pen. Very good.
Cranial nerves number 4 and 6 kind of go together. We have the trochlear and the abducens, which deal with the eye muscle movement. At this time, she would do the 6 points of gaze.
Ms. Saliga, will you follow my pen? Good.
Number 5 is the trigeminal. That deals with the motor. For example, jaw movement. Able to open and clench jaw. Sensory, which is touch. Something stroked against forehead, both cheeks, and jaw.
Ms. Saliga, can you clench your jaw for me? Very good. And can you open your mouth real wide? Very good. Can you close your eyes, and I'm going to touch you, and you tell me if it's soft or hard.
Okay. Soft.
And what cheek?
Left cheek. Soft.
And where is it located?
Right. Jaw. Chin
Okay.
area. More hard. And right cheek.
Very good.
Number 7 is facial. The motor aspect is facial muscle movement, having the patient smile, wrinkle forehead, and whistle. Sensory is taste on tongue. For example, salt.
Miss Saliga, can you smile for me? Can you crinkle your forehead? Okay, very good. And can you whistle or make the action?
I can't whistle, but I'll try.
Very good. And if I had something salty at this time, I would place it on her tongue to see if she could taste.
Moving on to cranial nerve number 8, that is acoustic, sense of hearing and balance. For hearing, you could rub your fingers together at both ears, and balance, you would have the patient stand with eyes closed.
Miss Saliga, we're going to rotate to this side of the bed. And I'm going to ask you to close your eyes and tell me when you can hear my fingers.
Here.
Okay. And can you open your eyes back up and stand up? And close your eyes and stand still. Okay. Very good. You can open your eyes and sit back down.
Cranial nerves number 9, 10, and 12 go together. Number 9 is glossopharyngeal. Number 10, vagus. And number 12, hypoglossal. She would go ahead and check gag reflexes and taste. For example, swallowing a glass of juice. And then tongue movement. Sticking out the tongue and move it side to side.
Miss Saliga, can you sit up and take a sip of this drink and swallow it for me? Very good. And can you open your mouth and move your tongue rapidly from side to side? Good job. Thank you.
Cranial nerve number 11 is spinal accessory. Flexion and rotation of head and shrugging of shoulders against resistance.
Can you sit up for me, please? Thank you. And I want you to shrug your shoulders with me pushing down. Very good. Now, turn your head towards the friction. Very good. Thank you.
All right, now since this is a head-to-toe assessment, the nurse would now begin at the head of the body. She would be checking for the hair, she would be checking for lumps, observing the scalp, and checking for anything like lice.
Have you fallen in the past 3 months, Miss Saliga?
No.
Okay. You don't have any bruises or bumps on your head I need to know about?
Moving from the head, we go to the face where we have the eyes. She would then look at the eyebrows, eyelashes, any redness, conjunctiva, and ask the patient if they may be wearing contact lenses or glasses.
Miss Saliga, do you wear contact lenses or glasses?
No.
Okay. Do you notice any irritation in your eyes? Okay.
Moving on to the ears, she would inspect them for symmetry, look behind the ear, and inside the ear.
Do you wear hearing aids?
No.
Good.
The nose, she would inspect the nostrils and the septum.
Do you have any sinus issues right now? Any trouble breathing? Okay.
Then, observing the face, she would palpate the face for any pain, and again, checking for sinuses.
Does this hurt at all? Okay.
Moving to the mouth, she would look in the mouth, ask about her teeth or if she wears dentures. She would check the gums, tongue, and mucous membranes.
Can you open your mouth for me? Do you have dentures or partials? No. Okay.
Then, observing the neck, she would inspect the neck and palpate the lymph nodes.
Does this hurt at all?
While she's in the neck area, she would check the carotid artery pulse. She would palpate on one side at a time. Now she would have the patient sit up a little bit and listen to heart and breath sounds. For the heart, she would begin at the aortic area, which is the right side of the sternum, second intercostal space. Then move on to the pulmonic, the left side of the sternum, second intercostal space. Then to Erb's point, the left side of the sternum, third intercostal space. Tricuspid, left side of the sternum, fifth intercostal space. And finally the mitral area, left side of the sternum, fifth intercostal space, near the apex of the heart.
I'm listening to aortic, pulmonic, Erb's point, tricuspid, and mitral, where I'd also listen for the apical pulse for 1 full minute.
Then moving on to the breath sounds, she would check both the front and back, listening for any abnormal sounds such as crackles, wheezing, pleural friction rub, or vibration.
Can you take a deep breath for me? And one more. And again. Again. One more time. And again. And can you lean forward for me? One more breath. And again. And again. One more time. And again. And again.
Once she's done listening to the back area, she would also inspect and palpate the spine and sacrum for pressure area and check if there were any signs of scoliosis.
Very good.
Now moving to the front of the body once again, at this point she would check the breasts. She would observe them for the size, shape, symmetry, and palpate for nipple discharge or for any lumps.
And for the videoing purposes, we aren't going to do this to Miss Saliga, but I would just check to make sure that they were symmetrical.
She would then check the collarbone, palpate that for any disturbances.
Does this hurt at all?
Now moving on to the arms. She would inspect the skin, look for pressure areas on the elbows, and check range of motion.
Can you lift your arm up for me? Can you lift that one up for me too? Thank you.
While we're at the arms, we would then check 2 major pulses, one being the brachial artery, which is on the inside of the elbow, and then moving down to the radial artery, which is at the wrist. She may do this bilaterally and simultaneously. And also, if the patient did have an IV, she would check the status of that IV.
Miss Saliga does not have an IV, but I would just check the arms for if there was any.
Now moving on to the hands. At this point she can check the skin turgor. She would look at the fingers and the nail beds, checking for capillary refill, and also checking grip strength at this point.
Can you grip both of my fingers? Thank you. And I'm going to check her skin turgor. Both hands. And also cap refill. And I would ask to do muscle strength. So I ask her to push my hands and pull them. Very good.
Now she can have the patient lay back, because we're going to move from the GI system down to the toes. At the GI system, you want to inspect, osculate, percuss, and then palpate. You osculate for 2 minutes. If nothing heard, then you listen for 5 minutes. Listening for hypoactive, normal, or hyperactive sound. You can also question about bowel activity, last movement, and consistency.
For videoing purposes, I'm going to keep her gown on, but I will still listen. I'm just going to observe from what I can see. I'll listen in the right lower quadrant, the right upper quadrant, left upper quadrant, and left lower quadrant. And then I would observe my patient's facial reactions when I palpated her stomach, and also ask her if it hurt at all. And when was your last bowel movement?
This morning.
Okay.
Then moving on to the GU system, she'd want to find out things about the kidney function, and if she has difficulty voiding at any time.
Miss Saliga, do you have any trouble urinating?
No.
Okay, and you don't have any problems with your kidneys? No bladder infections? Okay, and you have a regular menstrual cycle? Okay.
Then she would move on to the female genitalia, but of course, for video purposes only, she will not be doing that at this time. She will have the patient roll over and inspect the buttocks.
Miss Saliga, can you roll that way? Now I just look at her bottom. Good. Okay.
While she's in this area, she would check another pulse. That would be the femoral artery pulse, checking both bilaterally and simultaneously. And that is in the groin area.
I would check this pulse right here. For videoing purposes, we won't go in depth on that.
Now she moves on to the legs. With the legs, she wants to inspect them, check the range of motion, check the calves for warmth, edema, or pain.
So I look underneath the calves and check for any warmth or pain when I felt them. Edema. Okay.
Okay, now being at the legs, there is another artery to check. That is called the popliteal artery. It is located behind the knee. Again, you can check this artery bilaterally and simultaneously.
Okay.
Moving on to the feet. We inspect the feet for edema. We check the toes for, again, capillary refill. We check pressure areas on the heels. We have the patient lift her feet off the bed, push toward your hands, and pull away.
I would inspect the bottom of her heels for any sores. I would check for cap refill. I would also check the pulses.
And as she mentioned those pulses,
Can you push for me?
they are actually the dorsalis pedis artery, which is located on the top of the foot, and the posterior tibia, which is on the inside of the ankle.
Can you lift this leg for me? Okay.
As she wraps up her assessment, there are a few additional questions that she may feel a need to question. Number one would be, do you smoke? Do you drink alcohol? Are you sexually active? And then, of course, do you have any questions for me or your doctor?
Miss Saliga, do you I just have some general questions for you. I just need to know if you smoke.
No.
Do you drink?
Yes, occasionally.
Okay. And are you sexually active?
Yes.
And and you're on birth control if you're not trying to have a child?
Yes.
Okay. And do you have any questions for me or your doctor that I need to report?
No, I think I'm good.
Okay.
Thank you.
All right, as she moves on from there, she wants to check the 5 P's. And of course that is, are you having any pain? Do you need to use the bathroom? Are you comfortable in your bed? If able, would you like to sit in a chair? Put the call button, television remote, telephone, water, and any other personal belongings within reach.
So at this time, I would check the 5 P's. I would ask Miss Salaga if she was in pain. Are you in pain?
I'm not.
Okay. And are you comfortable in your bed? Okay. Do you need to use the bathroom?
No, I'm good.
Okay. And I would put her call light by and her drink and put the bed in the low position. And then I would, once I was completed with that, I would remove my gloves and wash my hands and document my findings.
That concludes our assessment for this afternoon. Have a great day.